Psychologically,
All right.
it makes you feel warmer than.
It does. All right, we are ready to
Ready to roll?
start.
Are you recording?
I am.
Okay, first of all, thank you all for coming in today. I know it's horrible out there, so appreciate you braving the monsoon. My name is Bill Hassett. I'm with HIPnation. Some of you folks have had the pleasure of listening to me speak already, so you're going to hear some redundant stuff as I tend to say the same things over and over again. With me today, though, I brought a special guest star, Mike Giulio. Mike is a licensed insurance broker, as I tell folks that I'm talking to all the time. I am not. But Mike is a trusted resource, a good guy, and somebody who I think that ultimately for catastrophic care can take good care of you guys. So he's going to be an important piece of the solution that we put together for y'all. For those of you who haven't heard me before, HIPnation, what we are is a direct primary care provider, your doctor. 80% of all medical care happens in your primary doctor's office. Those people who regularly see a doctor, particularly those people who see a direct primary care physician, that number jumps to about 93%. In any given year, you have a 7% chance of having some kind of out of normality medical event. Could be a broken ankle, could be a stroke. In between that is all this other stuff that happens that isn't your direct primary care. So the analogy that I always like to use to tell people basically how we do business is when you go get an oil change on your vehicle, you pay $35 for that and you move on. When somebody smashes into you on 285 and does $10,000 worth of damage to your car, you're going to access your insurance policy. So unfortunately in American medicine, insurance is endemic in every avenue of everything that occurs in healthcare. And because of that, every dollar that you pay is inflated. And it's inflated not just on the premium end, but it's really what I just call your total spend for the year. Every out-of-pocket dollar that you're doing up to meet a deductible, whether it be a copay, co-insurance, all of these insurance terms that we've all been programmed to live in and listen to. HIPnation's model has eliminated the insurance piece from the primary care piece, and then ultimately we've built a relationship with 21 specialties, 75 specialists in a number that's constantly growing. We are expected to bring a good name, you'd probably recognize from the area of Resurgence Orthopedics on as a partner here shortly, but as I stand here today, they are not. But again, this is the level and the quality of the people that we're bringing on board here. We've got 16 direct primary care physicians' office in the greater Atlanta area, a number that's also growing all the time. But again, I'm going to talk to you in terms of what I've got to you as I stand before you today. The ecosystem document, which I've got outlined for you there, again, it's just a brief overview of our services. But the big takeaway that I want everybody to understand from the way that specialties work with us and how this model can really save you guys some money on top of providing an extremely high level of care is these people have negotiated rate structures with us. So by example, an MRI in the insurance-based world, if you were to go to Resurgence Orthopedics and use your Blue Cross Blue Shield insurance card, that's about $3,000 for that. The negotiated prices that we have is $399. You know, it's a significant savings on that piece. A colonoscopy, a pretty common test for folks who are getting a little older. It's about $3,800 on average in the insurance world. We get that done for $1,200. So that number just keeps carrying through to everything that occurs, whether it be lab work, diagnostics, all these things. So that every time that you're coming out of pocket to spend, which you will, because it's just the nature of how it goes, with a traditional insurance plan, you're going to have a deductible. Most people carry about a $5,000 deductible. And then every dollar that you're spending out of pocket, up to that $5,000, is cash. You don't pay it on that day, but you get a bill 30 days later, and then you pay off on whatever that bill is. In our scenario, you're going to pay up front for that service. You're not going to wait 30 days to pay that, but you're going to get a savings anywhere, generally on average, about 70 cents on the dollar. So when you look at your total healthcare spend for the year, on the premium perspective, which is how people tend to view this, it's probably going to be pretty close in terms of what the primary care piece will do for you, what the catastrophic care piece will do for you, but I'm going to tell you that it's the overall spend that you have where you're going to see a significant savings. That's the financial piece. I'm going to preface that by saying everybody says that healthcare is a top-of-mind discussion in the United States. Everybody's number one concern. I would argue that 97% of the time we're talking about healthcare finance. You know, how are we going to afford this? What do I get for my money, etc. And then, oh, by the way, there's care. You know, if you access it, there's some level of care that you're receiving from a doctor. HIPnation's philosophy is it's care forward. Our doctors all came out of insurance-based practices, of which 75% of their time is spent on non-patient care activities, i.e. billing, chasing payments with insurance companies, making sure that code 3101 was entered versus 3010 so they can get paid. 75% and 66% of cost in every doctor's office, and this is insurance at work. Our doctors have left that model. They're now 100% focused on patient care. They're basically turning themselves back into Marcus Welby. They love it. They're spending 100% of their time with you. So the care you're going to receive in your doctor's office is going to be very different than what you may be accustomed to currently. The average doctor's appointment in the United States is 7.7 minutes. So you get there at noon for your noon appointment. First thing that happens is you go to the window and you get handed a clipboard with about 15 pages. Let's make sure your insurance information is in order. By the way, I'll need your copay. And then after about 30 minutes of that, you'll be sitting there. You're shuffled off into the holding area. You'll hear a bunch of activity going on outside the door, various people walking around.
Yeah.
And at some point, the door bursts open and the doctor comes in, right? And he's going to talk to you for 7.7 minutes. And ultimately, whatever's going on with you has to fit into that window because he's going to be on to the next person. You know, as our doctors explain it, it's really triage medicine. They don't have the time, because of the way it's structured, the way they're compensated, to treat you like a person and be concerned about your in-depth health needs. So with a direct primary care physician who is not worried about this time frame window, we're seeing 20% as many patients as an insurance doctor, so we have a lot of time to spend with you to make sure that you're getting a very high level of care. Ultimately, anybody who's a patient with us, and there are some folks even in this office, I think will be your best reference to attest that the level of care they're receiving is certainly something that they may not have been receiving in the past. I believe all doctors are good doctors for the most part. I think they're all good people. They're in medicine because they wanted to do good. But I think that the system ultimately has put them into a place where they're only able to spend X amount of time with you, and it's more billing than it is anything else. So from a primary care perspective, I am super confident, and I encourage you, and there'll be information I'll send to meet our physicians. Absolutely patient care centric, focused on that, have your best wishes at heart, and all I think at a pretty reasonable cost. So it's a membership based model. It's not an insurance based model. It is $100 per month. Atlanta Realtors are getting $50 off their first month, which is rebated back to you in like 2 business days. It's probably 1, but I'm going to call it 2. So you would pay $100 for your first month. You would get $50 back pretty much immediately. Also included with your membership on that is going to be your annual physical and 4 lab panels that go with that. So any of you who have done that outside, cash-based, you know that that's got some value to you. Incremental labs can be run or may be run depending upon what your situation is. A good example of that is a cholesterol test. Most people want to see what that is because we're all familiar with that one. That's an $80 test in the insurance world. We do it for $3.85. Now you will come out of pocket for the $3.85, but it's a little bit of a better value than maybe for $80. Our doctors are going to try to build a strategic health care plan for you. What are you doing well? We're all doing some stuff we could probably be doing a little better, right? So they want to keep you healthy now for 2 reasons. One, it's your health. It's important. But secondarily to that, people who are healthier will pay less in the long term when they're sourcing out and paying for catastrophic care coverage. Look, you guys know, I'm now going to start telling you stuff you already know about. You're going to get insurance quotes out in the marketplace as a 1099, an entrepreneurial type person. The rate structures are, I'll use the word extraordinary. I mean, mortgage payment type stuff. You know, it just becomes untenable and really becomes a question of how do I afford this care? And even those of you who, some of you are using some kind of care package, there's so much expense loaded into actually going to see the doctor that you view it as a trip to the ATM that's just going to cost you more. So you're just using your catastrophic policy and ignoring your day-to-day health. You know, I don't know if this is the ideal thing to be paying $500, $600, $700 a month for, but I understand the rationale behind it. So, healthier people, better quality of service, 24/7 access to your physician via his personal cell phone. You're not going to reach a physician's assistant. You're not going to get the front desk. You're going to get your doctor on the Tuesday night when you think you just had food poisoning from some offbeat sushi. Unlimited visits into your doctors with no copays. The other thing that's important in our model, in the insurance world, care does not happen unless you visit a doctor's office. And the reason that is because they can't bill the insurance company unless you physically show up in their office. They have to make you come in, otherwise they don't get paid. In our model, you can call somebody on the telephone and receive, in many cases, enough information. Let's say you've got the flu, for instance, and they're physicians, I'm not, but they can figure out that that's what your situation is. You talk to them on the telephone, they're able to write a prescription, you're going to go directly to a pharmacist to pick that up. You're not going to drive 35 minutes each way across town to go see them. Now, I always caveat this by saying, our doctors would love to see you as often as you want to come in. But, your time's valuable and you got other things to do besides going to the doctor. So you're going to have unlimited access, and I think access is the key word because they're not just an office visit, but it's the ability to come in and see them for whatever reason you might have. So I think now we're going to get to the part of this discussion where that sounds great. What if I have a stroke? Right? And this is where we go from here. Normally, what I do at this juncture is I start saying, I am not a licensed insurance agent. So ultimately that gets a little tiring, and you hear it enough, and I can speak in generality in terms of some products that our members use to help protect themselves. But for that reason, I brought Mike along today, and Mike is an expert in a variety of different packages. Some of you guys are using some of the stuff that he's working with, some are using something that's similar to it. But I think the key is that by utilizing this direct primary care from us, controlling your cost in terms of what your out-of-pocket is, you're able to get more selection and more choice on something that's going to work for you. So there are some products out there where maybe you're not chasing a $5,000 deductible, maybe you're getting reimbursement on expense of some things that you're doing. Or that might be a model that doesn't work for you, you got some discomfort with that, that's fine. What we want you to do is what's right for you, what's right for your family. All of you have a different acceptable level of risk. All of you have a different variety of assets under management. So there's no universal solution where I could say, this is going to work for both for you and for you. But we give you choice, we give you some flexibility. You can make that decision for yourself. And there's a variety of packages I think that pair nicely with what we offer on the front end for our primary care. And then when you look at the overall bundled cost, again, I think if you look at it strictly on a premium term, it's going to be competitive, in many cases cheaper. But when you look at it in terms of the overall dollar spend that you'll have in any given year, I'm comfortable in saying that most people that we're talking to are saving 30–40% on their overall spend in any given year. So that's real money, I think. All of you probably have unique questions. I'm assuming you've all got some health concerns or some family member or whatever. First of all, we're being recorded, so you might want to hold those. But then secondarily also, I think it kind of bogs things down. But what I really would welcome is questions that you have in terms of how coverages that you may select will work for you and your family. And I think we can do that in a general sense, and Mike will be a good resource here to actually answer in better detail than I would give you. And then as we have specific, I have X issue with me and my family, I think that we can take that offline and discuss that more on a one-on-one basis. So if that works for you guys, I think that might be the best way to do that. Yes, ma'am.
Something general. For how long has been HIPnation working in Atlanta or in
So
Georgia?
HIPnation is a doctor-owned, doctor-managed practice. The only non-doctor in the whole company is standing in front of you talking right now. Dr. Hill, our Chief Medical Officer, has been advocating for healthcare change for over 10 years on Capitol Hill. HIPnation, Health Impact Partners, has been a medical consulting firm outside of the fact that he's a urological surgeon for 10 years. We started seeing our first patients 18 months ago, and our growth rates have been pretty extraordinary. We had 20 patients last September, and this September we were well north of 1,000. So our growth has been pretty good. We're growing the practice day over day. We've got new physicians coming on board all the time. One thing in terms of our physicians, a lot of them are Emory grads, have worked in Emory's healthcare systems. So one thing I should say is it's not like Joe's doctor college guys. I mean, these are high-end physicians that just got tired of the game, of the insurance game, and they're back to focusing on patient care. So longevity, I'd say we're relatively new compared to if you go look at like Northside Family Perimeter Medicine or something like that might have a footprint that's 12, 14 years old. Concierge medicine, which is kind of where this falls into as a category of care, is a growing field with physicians because, again, they're spending 75% of their time chasing money, and in a lot of cases, You know, they're not getting exactly what they're supposed to back. If they're billing for $10, they might get 8 or whatever it might be. So it's just a constant negotiation. The doctors, you know, for the most part. One of our doctors, the best example I can give, Dr. Sheikh in Roswell, who a fantastic physician, at one point decided she was going to quit medicine to go get an MBA because all she was doing was business stuff anyway. I mean, it's kind of sad that somebody's committed their life to you know, performing doctor care is not going to chase an MBA. So ultimately in this model, or you'll see there's other competitive type products out there in the marketplace. Everybody's different, right? I don't want to be the low-cost provider. I just happen to be on a subscription model right now. And that will change. But part of the benefit as an ARA people, we're never going to raise your rate. You guys sign up by the end of the year, it's $100 forever. So that's pretty good. And
But
if you
this
looked
is
around,
only for Atlanta, for Georgia?
Georgia-based, primarily, I'm going to call it primarily Metro Atlanta at this
Okay.
point, and really primarily on the north side of town. I've got a bit of a hole in my footprint right now on the Marietta side of town, but I'm literally this close to finalizing a couple of deals with some doctor practices in Kennesaw and Marietta, which is going to help my footprint, quite honestly. Anybody on the north side, you know, Roswell, Sandy Springs, Buckhead, Virginia Highlands, up and coming. We got a couple in Alpharetta. So pretty good on the north side, not as strong maybe on other parts of the city. But again, if you're in a situation where you're going to build a relationship with a physician where we're not making you drive across town, you know, if it's once a year that you're going in for your annual physical, or maybe some kind of emergency every once a year, maybe on top of that, I think that mitigates some of that issue of proximity. Yes, ma'am.
When you said 24/7 access to your doctor via their cell phone, you know, they do sleep and so answering services?
No answering services. The answer I've gotten from Dr. Herrera, who's a really good guy, is like, so 24/7, how's that working out? He's like, you know, sometimes they got to be a little patient with me for the first 60 seconds I'm talking to him because it's the middle of the night and I'm a little bit groggy. You know, so I mean, you are physically speaking to your physician. You're not being handed off. Now there is a caveat to that, and it's strictly for pediatrics. So any of you have small children that would be doing pediatrics. We do have on-call pediatrics, and the reason we're doing that is because if you give a newborn mother, a first-time newborn mother, access to a 24-hour care doctor,
Yeah.
we'd have 3 patients.
Yeah,
It just becomes untenable.
I get that. Okay.
Yes, ma'am.
What hospitals are physicians affiliated with?
I'm going to table that one for a minute because I think that that's going to go into how you talk about PCHS, right?
Sure.
They are not affiliated with a hospital. They're affiliated directly with my company. That doesn't mean they don't have practicing rights in certain hospitals. So they're not, like, it's not a Northside physician, but that doesn't mean they can't perform activities at Northside Hospital. For the most part, when you start talking about non-emergency outpatient surgeries, we're going to try to steer you to surgery centers versus hospitals, just because the economics of it are so dramatically different. You know, a surgery center where you go get an anesthesia, the room might cost $4,000, whereas if you went into Northside Hospital to have the same procedure with the same doctor done with the same anesthesiologist, just the room and having that done there is, you know, $20,000. So that's where there's the economics of this too, right? If you're used to just a traditional, here's my insurance card, you hand it to somebody, they file all the claims on your behalf, they do all your scheduling on your behalf, and they just do it to whatever the cost structure is and they don't care, then you ultimately pay the bill for that. But if you're willing to manage your costs on some level, be active to an extent, and I'm not talking about a full-time job here, but if you know you're going to go have a procedure and you can make a phone call and know that it's going to save you $10,000 or $12,000, I'd probably make that phone call. Does that answer your question?
I guess there's kind of 2 answers to that question, if I may.
Please.
So this practice is focused on direct primary care. If you have a surgical requirement that is an elective procedure, you have the ability to shop for the best provider at the best cost. HIPnation has already done the groundwork for you. So for elective procedures, routine procedures, they've actually partnered with dozens of specialists and facilities that they trust, believe, and have already given them the best price in town. So from an affordability and competence perspective, they've done a lot of legwork to get you access to the best doctors you need. If it's not elective, it's emergency. All of the things we couple with HIPnation come with a PPO network. So you're gonna get access to some of the largest networks in town. Depending on the plan, it could be a United Healthcare plan. It could be PHCS, which is one of the largest national networks that serve non-ACA plans. It could be an Aetna plan. We've developed a bunch of insurance solutions that wrap around direct primary care because we know the fundamental question always eventually turns to, what if I gotta go to the hospital? Your direct primary care, you don't do that. Well, we marry it up with a network that provides you access to specialists and doctors if they don't happen to already be those captured within the HIPnation relationships that have already been established. Does that make sense?
So how much does the major medical catastrophic care policies, how much do those run?
Sure. So there's, when you leave the
I
market.
know about the 100 a month.
Sure.
Wonderful.
So when you leave the marketplace, you've got 3 general options for healthcare. So if you don't want to go through the marketplace, and you're looking for options, it falls into 3 general bids, excuse me. One is faith-based healthcare sharing. You've probably heard Medishare. It's a really innovative solution. They're probably one of the closest to true catastrophic protection because of how they're designed and operate. On the other end of the spectrum, you've got what they call a fixed indemnity plan. It's designed around surgical care, hospital care. It does have a lot of routine outpatient care, but it's generally described, built around serving those hospital surgical needs, inpatient care in general. And then in the middle, you've got a short-term medical plan. You probably heard in the news over the course of the last couple months, there have been a number of rules changes about how to use short-term medical. They used to only be issued at 3-month increments at the most, and then you'd have to continue to renew. And now being written, depending on the company, 360 to 364 days a year. So within those 3, every one of them is very unique. They give you different ways to consider how you want to be covered, and that obviously affects potentially what that premium is going to cost. In general, we're finding savings between 20-30%, sometimes more for families from what they're paying in the marketplace. Big caveat, you hear it all the time in the news, this thing called pre-existing conditions. When you leave the ACA, pre-existing conditions matter. So we'll go into a lengthy conversation about pre-existing conditions. Are there any that you're concerned about? These plans could very well address your needs, your family's needs with a pre-existing condition. In some cases it won't, and we'll recommend that you stay in the marketplace. Or we seek an alternative through an employer-provided plan, and there's creative ways to do that if you happen to, a spouse, let's say, is a small business owner. Maybe you're organized in such a way we could creatively create a small business plan around you, and we'll find an employee we can W-2. In any event, we look for solutions, but there are going to be people that frankly may not fit best in our insurance solution, and we might recommend they stay in the marketplace or find another solution. But for many people, we find it's a much more affordable solution for them to make that.
Along those lines, is this a carve out? I mean, if you're on the current plan, I get mine through my spouse. So through her company, then we're getting pretty comprehensive care.
Yep.
Just typical of what you get,
Yep.
a deductible, a premium we're paying monthly.
Yep.
So is this thing where you can look at that plan and you can say, if I do HIPnation, I can carve out this portion of that plan? Will they allow you to do that?
Yeah,
or
you
do you
can
have
so-
to just tag it on?
Sure, you can look at how your plan is currently priced. You and your spouse have one cost, and your spouse as the employee has another. If the spouse isn't in the plan, you can see what that savings is, and we can take a look at what potentially provides another suitable option for you.
You guys do that on an individual basis?
Yep. 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 But it's interesting. If you want to see where healthcare is going, look at what business is doing. So what we're starting to see is, for the first time in a long time, businesses are getting tired of the rate increases and the premiums that they're having to confront, and their employees, frankly, are having to confront as well. And they're looking for ways to reduce their cost. And what you're starting to see large national carriers do, we've just started partnering with one, they're taking the direct primary care part of healthcare out of the plan. And this is going to sound like, what? They're taking the direct primary care cost out of the plan, and they're giving it to the direct primary care practice. Because what they're handling, they can do outside of insurance. As you mentioned before, all of that routine care costs. There are costs and overhead to the practice, so it's got to be marked up. There's margin everybody has to make to stay in business. that rates up the cost of the plan. So all that gets removed, and believe it or not, what you find is the total cost of that policy drops low enough where you can actually provide people direct primary care more affordably than having it built into the insurance plan. So the employer is seeing their total cost drop. And what's the beauty of this? Years ago, you used to think of direct primary care, kind of who the heck can afford it? 5, 6, 7, 8 years ago, you heard a couple of people in it, you were wondering how much they're paying for it. Pretty pricey. Now we can actually put employees on this with some of these groups, and they get access to 7x24 care. Absenteeism gets reduced because they're more prone to use care. All the data, all the science is showing if you can provide people, remove barriers to care, whether it be financial or convenience, they see their doctor more. And over time, they tend to be a healthier cohort, and overall prices in time start to drop. But as a society, we kind of got this reluctance of seeing the doctor and focusing on the preventative side. We tend to be more reactive. When you look at Europe and Japan, boy, the focus on preventative is very different here in terms of where they send their healthcare dollars. They focus on prevention, and in the long term, what all the science and data suggests, long-term healthcare costs start to go down as people obviously become a little bit more healthier because they're more active, proactive in seeking their care.
So taking this back out of the group model, back to these guys are mostly individual sole proprietors for the most part, is my assumption. But
well, the same thing holds true.
Yeah, it holds
the same
true for
access
sure.
to a doctor. In the end, it's about access to quality healthcare that's affordable, and it's on your schedule, not theirs.
as you take control of the cost structure yourself, as you move towards selecting what you want to do on the catastrophic care front, you're going to go see a doctor more regularly. You're taking control of your costs, not just now, but I mean, we all know there's a spiral year over year. If you just keep relying upon the insurance carrier to give you a rate structure, they're going to be more than happy that year over year that 15%, on average, people are seeing. In this scenario, you're kind of keeping your baseline number where now you're not just getting jacked up at 15% year over year. You have to think about it from a long-term perspective when you look at it that way, and that's usually the real advantage of that probably happens in like year 3 or 4 forward. But obviously your health is as valuable today as it is 3 or 4 years from now.
Where can we find the list of doctors that are assigned to HIP?
At www.HIPnation.com.
And what about the specialist and the pre-negotiated rates for labs, imaging? Is there a listing?
There's a
of
list for the
those
specialists.
providers also?
We do not publish rates on specific procedures and or labs, but on an individual basis, I'd be happy to talk to you about that.
Yeah, so as an example, that's a common question, and for very specific questions where somebody wants to know what their out-of-pocket cost is going to be because they're getting a set of labs. We have partnerships with pharmacies. We can do a lot of upfront research to help you better understand what that cost is going to look like. And I think you'll be pretty impressed when you look at, if you got a pretty sizable deductible and you're paying a lot of this out of pocket already, I think you're going to see that the savings are.
The other thing is, we're sitting here telling you that if you're going to spend 30 cents for every dollar you're spending now, and you're carrying a $5,000 deductible, I don't give insurance advice. I'm not a licensed insurance broker. Why not go for a $10,000 deductible, which is going to lower your month-over-month premium? So you're seeing that savings on the front end every single month. That's my own personal philosophy, and if you listen to our founders, they tell you the same thing. 96% of people aren't meeting a $5,000 deductible. So why not go to a $10,000 deductible? So instead of paying X per month, you're paying Y, and we're sitting here telling you that for every dollar that you're spending out of pocket, we're going to reduce it anyway. And if you're already not meeting it at $5,000, why not go to a higher deductible?
What did you say that percentage was? 90 what percent of people are?
96%
Aren't meeting that.
are not. So you're out of pocket up to the point of your deductible at
Right.
cash, but you're paying that cash at an insurance-based rate.
Right.
So you're getting none of the advantage of the insurance piece, just all the cost.
It's interesting, if you go to an online quoting tool and you start playing with deductibles and co-insurance, once you get up around 5,000, you see the price starts to drop off because insurance companies aren't seeing as much exposure above 5,000 compared to below.
What about an HSA catastrophic health plan? Does that exist? I mean, utilizing an HSA.
We could, but we don't do a lot of it. But that's something we can certainly look at.
On non-ACA
You can, if
compliant
you,
plans.
let me qualify that with, if you have an HSA, you can continue to use it, not for the membership, but for the care that you have as a function of being in the, with HIPnation.
There's another option on it called an HRA as well, which you can utilize even in a non-ACA compliant plan. The big difference between an HSA, a health savings account, and this other one is the employer controls the money in an
Well, I mean,
HRA.
I have one in there.
Okay.
So I don't have a control body.
I mean, that would be, so if you were the proprietor and you would manage that HRA versus your employees managing it, so if they left the company, ultimately as the employer, you would control the money.
What do you mean?
So an employee leaves in an HRA environment.
Okay,
The employer
I'm
controls the
HRA
funding.
versus HSA.
No, I know, I'm just saying the other option that you would have in a non-ACA compliant plan is the HRA.
Well, that's probably a question for people.
Yeah, we could talk offline. I think you'll find you can still leverage your HSA dollars.
How can we get in touch with you so we can discuss our personal plans?
I'm gonna be here for a little bit today, and then I'm gonna give you all my card, and feel free to call me at any time.
If you're on a plan and you've had an enrollment deadline, you've already submitted that you're gonna, can you change that?
So these aren't tied to any enrollment period. You can go into it with them whenever you want, and you can obviously leave the plan whenever you want.
Is it your experience you could change it if we?
So here's the thing that we're gonna have to wait before you change anything is, whether or not your specific needs will be met in a non-ACA plan, because once you leave, you may need a special enrollment period to get back in. So we'll wanna make sure moving is the right thing to do. So that's a conversation we can definitely have.
And as far as this goes, is there a minimum amount that you have to sign up for first, minimum time frame?
In terms of HIPnation's piece, it's a 6-month commitment for us. At that point, you can opt out. I think that ultimately, if you take advantage of the care and you're going to see these doctors, we haven't had many people opting out at this point.
But is it 6 months up front, or is it
No,
just
it's billed
6 months
monthly.
guaranteed?
It's 6
billed
months
monthly?
guaranteed. And actually, again, if you guys sign up between now and the end of the year, you're gonna get a lifetime guarantee on the rate. But yeah, at 6 months, you guys said this isn't for me, you know, off you go.
On the insurance side, if you would bundle with it, they're month to month.
Yeah.
Yeah, that's the other thing. A lot of people don't understand that insurance in the medical works exactly like your car insurance. They have a commitment to give you a rate structure for 12 months, but at any point in time, you can opt out, just like you could in a car insurance environment.
But the problem is then you can't jump right back
You
in
can't jump
because of
right
those
back, right.
enrollment dates that they
Correct.
specify.
Again, you have open enrollment periods for a variety of stuff. In our scenario, open enrollment is 12 months a year. So even if you opted out, you didn't like one flavor of what you're doing, and I would never encourage anyone, to Mike's point, to just randomly opt out. I mean,
Right.
You have to sit down and have a very detailed discussion, say, this is going to work for me. You know.
I think one of the things that I've enjoyed most about HIPnation is healthcare is complicated when you need something more than routine care. And we all have experienced stories. I've got my own personal family story where being retired military, for me, healthcare cost isn't the issue that it is for a lot of folks. It's the quality of care and continuity of care. When you get into a more complicated healthcare scenario, I'm basically in a Humana HMO. I love Humana, they do great folks. But when you leave and you get into a specialty environment and you move through multiple providers, trying to get a coherent understanding of what's going on, how you can shape it, what's the best course of action, it can be really hard to grab all those different pieces and put it together. That's one of the things I love about HIPnation. They become your healthcare advocate in every possible way, from bringing all these disparate pieces together as in a consulting.
Right. We're not gonna just hand you off,
Yeah.
here's a referral, go to your specialist.
Right.
I mean, ultimately, there's gonna be a conversation with your doctor and a specialist before you even see them. And they're gonna say, here's what we see as a situation. Do you think at this point in time this person needs to come see you? And ultimately, specialists wanna perform surgeries and they wanna do expensive procedures. They don't wanna do revisit your health and see if you even belong there. And, you know, a lot of people are shuttled off to specialists because it's just the way it goes. Again, as an advocate, your doctor's going to be doing back before you're even going to see anyone. They're going to verify that you belong there, and then every step of the way where you need to go to whoever, you know, they're going to be involved with that process with you. So, you know, a term that we're getting away from is quarterbacking your care, because that really doesn't effectively
Yeah.
talk about it, but they are a full-time advocate and are going to be
So there's-
fully involved in everything that occurs once you leave primary
There's
care.
three pieces that over time, it's become so obvious to me. One, this access to care is unlike anything we're accustomed to in the typical system. Two, they're not looking to push you out to a specialist. And if you do, they really are beside you through this whole process. And three, they are advocating and working hard to find you the best, most affordable price for any care that you might need. Those three things working together where you actually have unlimited access to your doctor to help with those questions and navigating all of that, I found has been incredibly powerful. I'm working with a guy right now who's in concierge care. I can tell you right now, he has 24/7 access to a great doctor. After that, that's where it ends. He's looking at a potential hernia. Well, he's getting no help from his doctor on what's the best place to go get his outpatient surgery procedure, and he certainly doesn't have anybody advocate. He's not even with us yet. I sent an email to the chief medical officer with HIPnation. He's running down the best options in and around where he lives. That's the kind of care these folks are committed to giving. They really are interested in working with you as almost as a partnership. So I'm pretty excited about what they offer compared to a lot of medical systems.
We're not a nonprofit. We're not a 501c.
Right.
I always feel it's necessary that, look, ideally we'd like to make some money doing this. But I can tell you that the management, the founding members of this company, I mean, they're trying to change medicine. I mean, they want to make some money, but they're going down with the ship. The system's failing American people. These guys have been doctors for 20, 30 years. They've seen just atrocious care for people, and this model helps improve that. Again, not everything's right for everybody, but ultimately the level of care and the importance that we're placing on that is paramount with the guys that run the company.
So Bill, when you sign up, I mean, you got a list of doctors here, they're all over. You got Alpharetta, you got Roswell, you got Buckhead area, etc. Somebody in Dunwoody. Do you have to choose that doctor then, or do you get a chance to actually interview some of the doctors?
I would encourage, so I do open houses at our facilities, once a month on a rotating schedule. I would encourage anybody to go visit that. But no, I mean, look, if you're looking to speak with one of our doctors will talk to you before you're a patient, because it's an important decision. I mean, it's your health, right? And picking a name off the internet is picking a name off the internet, right?
But let's say you do choose somebody and there's just not a really good connection. Can you make that
Absolutely.
change, or how does that
So you
work?
will choose a physician, and you will work with that physician. We're not a network in which you'd say, okay, I go to Dr. Bush, but this month I'm going to go over to Dr. Herrera, and next month I'm going to go to Dr.
Right,
Brown.
right.
So you would choose a physician, but look, like any working relationship, and this one's pretty important, if it's not there, you're not feeling it, or quite frankly, they're not feeling it, obviously we would change is best for all parties. But we do not intend to make this, hey, I'm in this area today, I'm going to drop in with Dr. Brown.
Yeah, no, and that's not my question. My
No,
question is,
because- no,
there's
it can
just,
change. If it
you
doesn't
know,
work,
there's
look,
something
relationship
for
is
everybody.
hugely
There's
important.
relationship deals, and some people may not be able to communicate. Like if
Correct.
somebody hears more, or the other one's more visual, just depending on how you
Right.
communicate, is a big deal. So I
absolutely.
didn't know how you actually handle those changes.
We'll do it internally, we've got a
Okay.
membership services group, and be like, look, I've been seeing Dr. Bush, and it's not really working out for me, and I like the service, but we're not jiving, or whatever it might be, and we'll work something out and get you to see somebody else. But no, I mean, look, you're obviously going to be able to speak with our doctors in advance of making a selection, and I encourage everybody to talk to our doctors, because, I mean, first of all, I know they're really great at what they do. And they do have different personalities. I mean, we have one, Dr. Bush, who I equate to being maybe one of the 10 best people on the planet. I mean, she's like Mother Teresa. She's unbelievable. But, if somebody who's not as interested in building as in-depth a relationship with her, might be better served with somebody else. And again, she's fantastic, but, she's going to want to know absolutely every single element of everything that you do. Because she cares. I mean, she wants to build a plan that's going to keep you healthy now and keep you forward. But for some people, that might be a little much.
I see on the left side of the handout, voluntary protections.
Yes.
What does that mean?
So this is back to catastrophic care coverage, in which you, it's a menu option. What do you want to see? You'll see vision, you'll see dental, you'll see life. Ultimately, some of those things I have my opinions on, and those of you who've talked to me before have probably heard those opinions. Mike's livelihood.
Yeah, and simply stated, direct primary care is at the core, and as has been said, that's where the majority of your care is going to be provided, delivered, monitored. But gonna have hospitalization and other forms of care wrapped around it. That's what that represents, that we provide you access to all those different things you would want in a comprehensive
So like,
approach.
you wouldn't pay for vision if you didn't need it, right?
Mm-hmm, right.
Or, you know, you wouldn't pay for dental if you didn't feel like that was a good value for you.
Right. Most of us in this room are getting up there in age, so, you know, but I can see how some when I was younger, I might have skipped this and skipped
Right.
that, but I pretty much need it
Yeah.
at this point.
It's there if you need it, yeah.
If you're in a plan, you join in HIPnation, your primary care person is involved in your health care to the point which there is something that needs to be done on a hospital, and your hospital plan or whatever's going to cover all of that is that HIPnation person still involved in
It's still gonna be
helping you,
advocating on your behalf in the care
Perfect, yeah.
process. But now you're talking about how's it gonna get billed and who's the admitting physician. I mean, he'll interact with that person, but if you're talking about a specialty that's occurring for an in-hospital, you're still gonna work within that network of costs.
Now,
You're gonna have a health insurance policy that addresses that. You'll have a member card like you do right now, they'll present it at the desk and they'll bill you that way. Yep.
but I guess my question, what's the involvement of the HIPnation physician with
So
that
to kind
situation?
of, to use a practical example, I had back surgery a couple of years ago. I can tell you my primary care physician had no idea exactly what had happened and how I had to fill him in. He didn't get much from the specialist. That's not gonna happen in a patient. They're probably gonna know the surgeon who's working on it. And they're gonna be intimately involved in the workup and the actual activity, just making sure that they absolutely understand what's going on, and they're gonna have all the information they need to follow and make sure your recovery proceeds. I mean, they're gonna be with you every step of the way.
Kidney stone. I mean,
You're
what is
talking
that?
about, so that's like a hospitalization event.
Right, you go in,
Yeah.
I had one last year.
Yeah.
I go into the ER, and I mean, from there, I saw the bill. Thankfully, we had the coverage
Yep.
to offset the cost of the bill, but if I'm on HIPnation, that physician would be involved, or they would not, that would be my
Let's
first
say in that
contact.
case, let's say you go into the ER, you're gonna have to call your HIPnation physician at some point to let them know you're there.
Right.
But you'll have an
Probably the
insurance
first-
policy, maybe, you'll have an insurance policy that will wrap around you for that part of it. And again, it will be handled like any other insurance policy. And then once you come out, the care will be handed off to your HIPnation physician. But the moment you've gone in, at the appropriate time, he's gonna be connecting with the doctors that work 911 and following up with you and making sure that your recovery plan, they're intimately engaged in.
But are there negotiated rates?
Yeah,
For
so
instance,
you're-
I go to the ER.
Yeah.
Because I'm
Yes.
HIPnation, I've got a negotiated rate.
No, when you get into, so hospitals are different beasts, right? So, but that's why part of HIPnation is giving you an insurance policy that's part of a PPO network. So, as you would with any insurance policy, you've got a provider network, you've identified the hospitals that were in network, so you can make sure you go to the right one. And then they've got pre-negotiated costs, prices as a function of being in that PPO network.
Non-emergency outpatient procedures is where we have all the
Yeah.
negotiated rates with
Yeah.
specialties and diagnostics, et cetera. You're in a
Yeah.
true emergency situation where you're in the hospital, now you're in the hospital's world of whatever, and the billing is convoluted. That's when you're gonna start accessing this
And that's why with
catastrophic cost.
HIPnation, you're going to have an insurance policy, and as I mentioned before, you have 3 bins of options. You've got faith-based healthcare sharing and Medishare, as an example. You have hospital indemnity plans as another, and you have short-term medical. So those 3 plans will provide you a mix of different options to select from, and the question will be, does it meet your needs, both from a care point of view, premium point of view, and out of pocket?
It goes back, your comfort with what level of risk, what's your budget that you're using for that? Everybody here's got different amounts of financial wherewithal they're trying to protect. So people say, well, that's gonna cost me, and I usually say, well, how long's a piece of string? I don't know. Everybody's different, because you might need $5 million worth of coverage, where you might need $100,000 worth of coverage. Obviously, there's a
So
different price.
stories kind of help round out the uncertainty, because this is different. ACA plans are major medical plans. By law, they have to cover 10 minimal essential benefits, which pretty much cover everything. When you leave the ACA, the rules change, right? So what you're gonna find is a slightly different benefit mix. We're gonna spend a tremendous amount of time showing you what the benefit mix is to make sure that you're comfortable. One of the things that I found interesting, really impressive with HIPnation, we've had people with some pretty serious ailments that have left them with some out-of-pocket costs because of the deductibles and the co-insurance and the insurance sides that they picked. And it turned out that it was more than they had hoped they'd have to confront. HIPnation's been able to go in and work some solutions for these folks that have helped address those bills in pretty powerful ways. HIPnation's probably, when I look at the ability of direct primary care practices to influence a carrier, they're one of the only direct primary care practices that I've seen where I actually have a relationship with the CEO of one of the hospital indemnity plans that we offer, and they're actually talking about adapting their plans because of what HIPnation is doing. They're not there yet, but they're having those types of dialogue. So I guess what I've offered, you've got a very aggressive group in HIPnation that understand not only the direct primary care piece, but they certainly appreciate the need for a good wraparound insurance solution, and they've been working hard to make sure that that part serves their program as well. Because in the end, as their direct primary care patient, if you leave and go into that insurance solution and it doesn't work, that's not helping them either. So they're very aggressive in making sure that these things come together holistically. But when you leave the ACA, I'm gonna be frank, the ACA provides you a major medical plan. When you leave the ACA, you're gonna have different types of coverage, and we're gonna spend time making sure you understand what those are.
What is
The
the
marketplace.
Affordable Care Act.
Affordable Care Act. The marketplace.
Obamacare.
Yeah.
The marketplace.
It's
all
Kaiser,
of the above.
right? Anthem.
I'm better.
And
better.
better.
I'm better. And then what?
So can you walk me through a little bit, you said you have 21 primary care doctors currently?
21 specialties, 16 primary care doctors at this point.
Okay, 21 specialties. Do you have a facility like Kaiser? Like if you go
No,
to
so
a doctor-
basically, and like, I just recently had some knee surgery done, and you'll go to an outpatient facility, and you'll have it done there. I mean, you see surgical centers all throughout Atlanta.
Okay, but that's for non-negotiated, I mean,
That's for negotiated elective type stuff, non-emergency, non-invasive.
So give me some examples of that, knee surgery.
So like a knee surgery
shoulder
or
surgery, anything that you're doing.
orthopedics, hernia type surgeries, stuff that, the best way I could say it is,
Colonoscopy is a great
right,
example.
a surgery where
Colonoscopy,
you're
yeah.
saying, okay, I'll see you next Thursday to do
Right.
that. Not, you're in an ambulance on your way to go have surgery
Right.
right now.
And so that you pay out of pocket in negotiated rate.
Correct.
So you're not paying, that's not included in your.
No, that's gonna be, so
monthly
primary
obviously.
care is gonna be the stuff that you deal with on a day-to-day basis, like maintenance, you got the flu, you got poison ivy,
Right.
stuff that can be handled by a doctor in their office.
But though, you go into different offices for that, like whoever is your primary care doctor
Mhm.
happens to be a part of a North Side hospital practice or something like, or no, they're totally out.
Correct.
So let me use your example real quick. So you go to an outpatient surgical center, you have one of two ways you can pay. You can, if you've been able to, we've picked a facility that is in the insurance network that you've picked with HIPnation and is partnered with HIPnation. So you can either pay the cash discount, which odds are is gonna be less expensive than the negotiated insurance-based rate, which, depending on your deductible, you're gonna probably end up paying anyway. Right?
This is the point where I don't like the word cash-based, because up until the point of which you meet your deductible in the insurance world, you are paying with US currency, AKA cash.
Right.
You're just you're not paying for the point of service. You're gonna get a bill 30 days later, but you're still gonna be expected to make payment on that and pay with cash. The difference is gonna be, instead of a negotiated rate, again, the MRI example, if you pay $399 today, you're done. If you bill it through your insurance, which you'll be able to do, depending upon what your deductible is, it may make sense to do that, or where you are in your deductible cycle, if that's the type of plan you have, it'll be $3,000.
So you'll have both options. I mean, you'll be able to navigate this based on the financial situation, the total cost that you're looking to potentially either
Right.
embrace inside the deductible or not. So to make this even more interesting, some of the insurance products we provide, in addition to HIPnation, have their own negotiating services as well. So we're layering on top of HIPnation a bunch of other resources that can help as well. When you leave the Affordable Care Act, one of the things we're gonna have to start to come to terms with is we have to be smart healthcare shoppers. We're gonna have to be a little bit more involved in our care, particularly if we're looking to reduce our out-of-pocket exposure. HIPnation is an incredibly useful tool in doing that, because for a lot of us, they've already done that for you. Or if you have a procedure in need that hasn't been previously negotiated, they'll do it for you. They'll figure that part out.
The caveat I would say to everything that we're saying is this: is you're thinking to yourself, this is different. And I'm going to say, well, yes, that's because it's change. People have been clamoring for change, and ultimately, change is different. And, you know, again, it's a complex situation. It's a costly situation, and most importantly, it's your health, right? I mean, it's like the most important commodity we have in this world. So, again, not everything for everybody, but if you're willing to get involved in the selection of how you manage your care, there's a significant savings for that, and not only that, you're getting a higher level of care. But it's not business as usual, it's change.
You mentioned that there were 21 doctors on board, 16 primary care. What are the other 5?
16 primary care physicians, 21 incremental specialty offices, of which there's 75 doctors in those.
Okay. And what would be some of the specialty offices?
All but oncology,
Okay.
ophthalmology, internal medicine,
gastroenterology.
And you can go on their
Yeah.
website, they're listed on the website.
Yeah.
Okay. And so is there a different cost structure when you get out of your primary
There
care?
would be.
So say if I was going to wherever
A
that is, dermatology or
gynecologist might have a $75 co-payment to go see them, whereas a neurosurgeon might be $200.
And where would you find that out? Would you call them and they would tell you that
Not only would
price?
you call them, you'd already be talking with our doctors in your primary care, and we would be working
Yeah.
for you, scheduling all that with you.
So
We're not
you
going to
would
send
know-
you across town to do that stuff.
So you would know before you went in.
Yeah.
It wouldn't be like,
Absolutely.
now you go to the doctor
Well, not only that,
and you leave and you
right,
get a
we'll say,
surprise
well, if you want to
bill.
go to Dunwoody and see Dr. Brown,
Right.
you know, he's going to charge you $100. But if you're willing to drive to Kennesaw for Dr. Jones, he's charging $75.
Yeah, simply because they've already done the negotiated cash
You know,
prices.
so then it becomes,
before you
well,
go
you know, I'd rather go to Dunwoody.
So the basic
as opposed
costs
to-
are the same going in as far as the doctor visit. Now the procedures based on the
Again,
specialist.
so it might cost $100 to see Dr. Smith in Kennesaw.
Right.
Whereas with the same specialty, same level of care, but it's Dr. Jones and he's in Brookhaven.
Right.
And he charges $125.
Right. Would that be a doctor visit or would that be,
That'd be-
you go in
yeah,
and
that's-
diagnose?
that's the doctor visit to go
Right, right.
talk with him. And then ultimately, inside of that, there'll be diagnostics that occur, right?
Right.
Whatever it might be, test A, test B, test C, whatever.
Right.
But yeah, there's complete transparency to your costs. You know, you're gonna sit with your doctor and they're gonna say, okay, here's what we think. First of all, they're gonna already speak to a specialist before they send you somewhere,
Right.
because they're gonna try to figure out how not to send you there.
Correct.
You know, Hippocratic Oath says, do no harm. You know, it extends to fiduciary too. Do no financial harm. You know, we're doing everything we can to treat you as well as we can. So they're gonna do that, but ultimately you have to go, right? You've exhausted whatever we can do. You need to go see a doctor for your condition A, and we've got 2 different or 3 different doctors, whatever the math is. This one charges $100 to see him. This one charges $125 to see him. This one's 2 miles from your house. This one's
Right.
37 miles from your house. You might say $25 is worth it to me to go around the corner versus, you know what I mean? Then it just becomes personal. There's a lot of personal choice in it.
Correct.
I can tell you this, that every specialist in every specialty that we've vetted that we're partnered with, I mean, they're solid at what they do,
Right.
and they're patient care focused. Because look, we could have a much larger footprint of primary care physicians and a much deeper relationship with a lot more specialties,
Right.
but they gotta work within the constructs of our core beliefs, which is exemplary care.
So if you get into, once the specialty, whatever it is, when you go in, I know you have negotiated rates going into the specialty, but once you get in, they start providing their service within that specialty.
Correct.
Are they
But
still
again, the
negotiated
diagnostic-
rates?
Yeah, they're still negotiated rates,
Okay.
because you're a HIPnation patient, you're getting
Okay.
favorable rates versus.
Okay.
So you can actually, to be honest, I mean, to be fully transparent, you can go negotiate cash prices with anybody.
Right.
But your ability to do that
It's
as a
easier
one
for you to
person,
do it,
you know,
yes.
yeah, I mean, look, this is what we're gonna
Economies
do.
of scale is a beautiful thing.
And if I can just jump in for a second, so it is a completely different mindset with healthcare. I had to go through this about a year and a half ago. So my Kaiser that I was with was a PPO. Kaiser was gonna cost me $820 a month without going to the doctors, with a $6,500 deductible, and every time I walked in, it was a $60 copay.
Right.
So if I took all that money and put it in a kitty, and then just drew off that kitty, I still, over a year and a half, had not even reached a $2,000 fee. So you have to think of it almost like, in mortgage, how we had, you've got regular 30-year mortgage, and then you had, interest only. Remember when interest only was so good? Everybody kept thinking, oh, interest only, so I just pay interest. No, you can pay your principal too and buy your house down. You don't have to pay,
Correct.
You
can leverage the savings any way you want.
So you just have to really put your fees down, like what you're paying on a monthly basis, and how many times do you go to the doctor, and what's the difference of paying $100 a month and not paying $820 a month for 4 months, 5 months, 6 months, if you don't even go to the doctor. And then to know you have this care there for $100. It just makes complete sense. For me, anyway. Everybody's different.
Right, no, I get it.
But I do have some, I have some
in your
medical
scenario,
issues.
the plan you had was a
So I have
cash-based plan.
PHCS
pretty
as
much.
well as a complementary, critical care, catastrophic, and emergency. So I'm working off two, and I think the money I'm saving is ridiculous compared to what I was not saving with the big PPOs.
And again, and it goes back to my statement earlier, again, we're talking about healthcare finance here, right? We just keep coming back to how am I affording this? And not a lot of questions are coming up about, I'm used to getting a really good level of care with the physician I see right now, and I'm really concerned that I'm not going to get a really good level of care with you going forward. Not one person here has said that yet. So ultimately, you're accessing a superior level of care. And again, ultimately, as I look around this room, most of you, there's going to be a significant savings to do so. However, you have to be engaged in the process. If you don't want to be engaged in the process of getting a bill and putting it in the mail and filing a claim for you, or going and seeing somebody and saying, hey, I've got this deal that's negotiated via HIPnation, although they've called ahead, if you're not willing to interact on any front, it's a value, right? You should continue to pay $2,000 a month because you have the financial wherewithal to do it, it's working for you, and you're satisfied with it. So, if I was satisfied with something and I could afford to do it, I wouldn't change. But if I felt like I was paying a lot of money for something and the value proposition was a little upside down, I might explore it a little further. But that's me.
Can we have the business cards?
Yes, ma'am, we'll get you those. Yes, ma'am.
Is it $100 per person?
It is.
And family?
It is. So, and then
family
we haven't talked about
lives.
pediatric care at this point. I don't know where you walked in. Pediatric is $60 per month, but there is a co-payment on that. It's $40. Instead of having 24/7 direct access to your primary care physician, there are on-call pediatricians just because of the nature of pediatric care and newborn moms.
Let the doctors have a life.
Anybody on the VA? Anybody with VA coverage get on?
Yeah,
Well, for HIPnation, absolutely. So, great question, because you start getting into coordination of insurance policies and which one's primary and which one's secondary. I do HIPnation. I don't do the other products because it'll disrupt my benefits.
The thing is, people with VA care, if they've got Medicare, they're covered on catastrophic care. So in my scenario, great. You don't have to worry about any of this incremental hundreds of dollars a month for if I get cancer thing. But as a Medicare person, if you go to try to schedule an appointment to go see your doctor for a physical, they'll say, well, how's June 12th? We can see you maybe in September. Your level of importance is, no disrespect, diminished. And quite frankly, if people are paying $100 a month in greens fees, and you're getting level to a 24/7 physician,
So when we wanna sign up, do we make a point?
So here's
Parallel or
here's how we're
one-stop
working.
shop?
So I'm the conduit into HIPnation, and then you guys are going to ask me a ton of questions about stuff, and then I'm going to talk with Mike generally. As it gets a little more complex, I probably farm that stuff out to him directly. I got to be honest, I haven't been doing that for one very key reason is insurance people tend to talk in insurance talk. And it's a complicated world, and then it opens more questions at times than I think provides answers. Whereas I'm kind of a simple person, and I try to simplify that down to the point where you can make at least an educated choice of what you may want to do, at which point I would send you to an expert to go into the nuts and bolts of it. So So
I
that's
don't have
my
time
philosophy.
now, can we have the contact information and then, I will be able to reach you guys all?
I think he just told me to play, he'll give you his card.
No, but I say, I will need both. I'm not
Okay.
going only for
No,
the
absolutely.
care, I need emergency.
Absolutely.
So,
Um,
I cannot stay longer, so.
Is there any questions that we're not addressing? Is there anything that feels a little sketchy?
Do you have extra handout?
Yes.
Oh, yeah, she needs one too.
How about, there, more people are speaking up?
Can I just get one, clarification one more time? So, I mean, all of us are gonna need to supplement this with some sort of emergency care.
If it was me, I would say you should do that.
Yes.
There's no requirement for you to do that.
Right, no, I know, I understand what you're saying, but I'm going to.
Yeah.
So, how do you get rates that are more favorable than in the ACA? Like, because you're taking primary care totally out of it? And
Well,
I know
think
you
of-
said there are 3 different options, so, I mean, like, I couldn't get Humana or Blue Cross as an individual, like, we only have 2 options now, Kaiser and Better, period.
And Blue Cross Blue Shield is.
Blue Cross Blue Shield.
They're back?
Yeah.
Oh, okay. I
Yeah, they're
understand.
back.
But at the
And
same
that-
rate
that's-
in every county.
Okay.
They're back and they're only $300 a month.
Starting in January?
No, I'm kidding.
For sure.
Are you
So, great
withholding this
question. So
from
just,
your-
I guess, think of it in very
Some people
simple,
need-
financial terms. An insurance company brings with it a ton of overhead.
Right.
Okay? You're not gonna, yeah. Right, so that's one part of it. The other
Yeah.
part of it is, because the ACA mandates that they cover, well, generally speaking, everything, you can't tailor a plan. And thirdly, they cannot deny coverage for a pre-existing condition, and they can't rate based on a pre-existing condition. So they have to absorb all the risk when they quote plans, all right?
Right.
All those things drive up cost.
Right.
We pull out of that, and we're willing, and we work with doctors and facilities that are happy to work with us on cash-based pricing, because for most of our clients, they're not gonna use insurance to handle claims, billing, follow-up. All that's been removed from the model. All of that drives down the cost.
It has the ability to put pre-existing condition requirements on the person who's applying for the care. So if you're in a situation where you've got a $10,000 a month drug that you're taking, you are gonna fail at underwriting with any one of these plans that he discusses with you.
Right.
You're really gonna have very little option but to go pay X on your premium per month. But if you're paying $10,000 a month for a drug, and they say it's $2,000 a month for the insurance, you know what I mean?
Right, just go ahead and pay
Oh, yeah.
$10,000 a month for a drug.
Because otherwise you're not ever gonna, well, I shouldn't say never, but it'd be a pretty good year when you're paying your first $150,000 to drugs. So that's the difference in the ACA, right? So the ACA will cover anybody, you know, no matter what your condition, and because of that, everybody who's in the ACA is in the same risk pool, and that's why you're paying
Right.
$1,800 a month, or whatever your number is. Some, you know, everybody's got different
So
numbers, and
you're
some
in
are
different
extraordinarily
risk
high.
pools with the-
Correct, it's a non-ACA program, but you're not assuming everybody's preconditioned. However, if you have preconditions, you still may be able to get underwritten with certain policies, but there'll be exclusions, and look, your rates are gonna be higher. Not necessarily higher than than an ACA one, but it's not gonna be as robust as somebody who's fully healthy.
Got it. Okay.
Sunk.
Okay.
So Bill,
Yes, sir.
in a nutshell, you're in a plan, paying X amount a month, you got a deductible,
So my guess is that your spouse has some kind of
$1,500
corporate plan.
deductible.
$1,500 deductible?
Yeah.
That's pretty good.
Wow,
That's pretty good.
that's low.
That's low. Very low.
You're-
Still, we would avoid going to the doctor because we don't want to be.
$6,700 or whatever.
Right.
so.
So, I mean, ultimately, I'll be as frank as possible with you.
Definitely not an
If you've got a robust corporate-based healthcare plan in your family, I'm gonna say you're probably in a good spot.
Yeah.
I mean, You know, the quote that I just saw, a pediatrician was just elected to Congress, the only doctor who just got elected to Congress in this round. And politics aside of it, you know, her quote was, the job lottery shouldn't determine how you get health care. You happen to be a winner in the job lottery. You know, your spouse has a really good corporate plan, they've got a lot of purchasing power, and they're able to get you probably something that's only a couple of $100 a month for the two of you, with a $1,500 deductible.
$900 a month.
That's high. But, you know, the deductible's
Times
$1,500.
Times
Yeah.
12.
Yeah, that's the point.
Understood.
Raise your deductible.
So what I-
So looking at
premiums.
take a
Yes, sir.
higher deductible and a lower monthly payment,
Right.
roll
Again,
in
so
the dip.
everybody has a different appetite for risk, you know?
Yeah. I'm just-
I would never tell you what's right for you.
So as an example, I have a couple, spouses got a plan, super cheap for them, bring in the family, premiums go up. They're looking not to put the spouse in their son.
I mean, the key point that was made earlier is if you're paying $500 a month less on your premium, and you're willing to utilize some money management with that and not just go to Cabo, you know, you're putting $6,000 a year into a possibly interest-bearing account. I mean, again, this is now, we're talking about however you manage your lives are. You know, that you may have to utilize, but if you pay that premium every single month, you are utilizing that, and you're never getting a
It's
chance to
sunk
utilize
cost.
it. It's sunk cost. And the other way, at least you're giving yourself a fighting chance that, you know, let's say I stay healthy for the next 3 years, knock on wood, at $500 a month, I got $18,000 sitting here. You know, you could probably offset some expense with that. But again, everybody views finance differently, and I would never presume to tell anybody how to do that.
So Mike, since someone failed to bring business cards, you wanna rattle off contact? I mean, would you prefer to
Well, I
hear
think
from people phone or
Did you want to
email?
take the time? Of course I didn't bring. That's why they talk to him. He's the brains of the operation.
I am fully willing to be the conduit into Mike. I will send you an email with Mike's information.
But I'm happy to give you my name, number.
There was just one or two people that were,
No, believe me, I'm not looking to shield anybody from talking about insurance with him, because I'm on the primary care side. I mean, insurance is a necessary evil.
okay, I need some more of your cards, sorry.
Yes, I'm 6 years old. How do I know? What is a piece of cancer called? It's such a mystery out there. Do I get 1 million money?
Yeah, if you take, so,
Yeah.
can't answer it all.
I know.
The research that I've done, looks like the majority of cancer initial treatments are all done within 0 to 100,000. You have real catastrophic cancer that can go up to $1 million.
So if I'm signing up and it says name of broker, is that my broker here? Is that what they're talking about? Healthcare broker?
Sure, and policies are written like that. It's not a hard number to reach. It's perfect. 1 million, 2 million, around where you see it.
And this age area that I'm
Yeah,
in
what does it
is,
say?
you know, kind of.
Am I supposed to say, how did you write out his broker?
Yeah, so you want to make sure you have. So what you typically So what you typically do, yeah, so great question. So here's one of the ways you have to think differently
So
than
Susan
you do in the
is doing
marketplace.
this, anybody else?
Cause of the need
But where's my?
Well, no, I'm.
Layer.
Now she
Yeah,
can
put it
write
in
on
one
plan
plan.
last year.
Yeah,
Put in
you can put
Connie
cancer
Martin.
policies or
Okay.
hospitalist policies.
Like a rider.
When I
You
did this
end up
before,
putting
and then I got out
riders
of
in
that.
additional policy, you end up cobbling together something that addresses your specific concerns, needs, and ultimately things like you want.
I'm just not a gambler.
Right.
That wasn't addressing that I heard from him, because I neither my husband. You weren't even there.
Not as much because you're not in the same,
Okay.
you're not in the same rate.
So,
So all these plans are gonna be
So I'm a true
underwritten.
believer in
As a function of
pay as you
underwriting, the
go.
pool is healthy.
We've negotiated costs.
It's not gonna be the same
Again,
cost.
problem with our healthcare service is not accessible. It's affordable.
Depends on the breed, depends on the breed.
But I don't think it's true. It's not, it's
No, I mean, we've got good doctors.
Well, no, the payment system's terrible.
Yeah.
Obamacare
So,
never
it's a
addressed.
great example.
Yeah, the affordability issue, if that's
Right.
accessible.
After 2 years, and then
They are the
Yeah.
problem. If I'm an insurance company, I'm gonna make my 20% a year.
Which is the same as Liberty.
Insurance care is the
Yes,
only
in
thing that's
terms
gonna
of
20% a year
self-care
last
sharing
year.
networks,
So-
but